To maintain the erection to enable intercourse to take place, certainly in the early stages while you're working through penile recovery, the rings are available to you. You might also be taking medication, no problem at all. As we said previously, you can combine the medication with the use of the pump. The rings come in two sizes, two physical sizes, sort of larger rings and a smaller version. The difference is, as you can see, there's a pink and a beige material. The beige material stretches more than its pink equivalent or applies less pressure. Therefore, what you're looking for is to try the beige ring first, because the principle of maintaining an erection is not to choose the smallest ring and cut off and trap the blood in the penis, but to apply the least pressure that's necessary to maintain the erection. So there are two ways of putting the ring onto the cylinder. The way that I would encourage everybody to do it, if they can, is manually. By that I mean putting thumb and fingers in the thick bit of the ring and stretching it over the end of the cylinder. It does come with a ring loader, but unless you need to, because you haven't got the strength in your fingers, you might be suffering from arthritis or have had a stroke, unless you need the ring loader, don't use it. It's just fiddly, it's time consuming, you have to put lubricant on the surface, and you've got to clean it up afterwards. So if you can, stretch the ring over as you saw me do and apply it. The way that I suggest using the pump is to have the writing or the label on the top of the cylinder. You then know that the top of your penis, so you look down and you can see the writing, you know that's where the top of your penis is. The reason for that is there is a top and a bottom to the ring. So the two lumps here are pressure points that are designed anatomically to apply pressure to the veins that carry the blood back into the body. The little groove at the bottom is designed to reduce the pressure on the urethra so that you can, if you get the ring in the correct position, achieve ejaculation with the ring on, which is important to some men. Clearly men who've had prostate cancer aren't going to ejaculate, but there are men who would wish to ejaculate if they can. Therefore, making sure that you have the pressure points on the top of the cylinder is very helpful if you know that this is where the top of your penis is going to be. So as you can see, I've positioned the pressure points on the top. If we're using this, that gets placed back in there, and the principle is you're doing all the things you do when you use it as an exerciser, which is lubricant around the end, a little bit of lubricant in the bottom, penis in here, you pump gently, create a good strong erection, and then it's a technique which you need to practice a few times of thumb and finger sliding the ring off the end of the cylinder, release the pump and take it off. The ring can stay in place for up to 30 minutes, as was said previously, and that is designed to slow down the blood flowing back into the body and maintain the erection. It's also designed not to cut off the arterial blood that's filling and creating the erection. So that's the correct positioning of the ring, with the pressure points on the top surface, and the little ears that you can see on the side of the ring are to enable you to remove the ring afterwards by putting fingers in there, pulling it gently apart. That releases the pressure. As the pressure on the veins is released, the erection will go down and you can slide the ring off. So I suggest to everybody, once you've found the right ring size, if you're thinking maybe later, perhaps this evening, it would be good to try the pump for intercourse, set it up ready. So you've got the handle in the end of the cylinder. Hour or so before, select the ring that you know works for you. Place it on the end. If you're going to use this, put that in. All you need to do, should you need it for intercourse, is place lubricant around the end, lubricant in the bottom, and you're good to go. It doesn't need to interrupt the moment. The last thing you want is to be fiddling around and saying, oh, where did I put the pump? Oh, which ring was it I was using? You want to be prepared. The less interruption, the more effective, the better for everybody and the experience that you're going to get. So you create the erection, slide the ring off, release the pump, you're good to go. If you've been using it regularly as an exerciser, it is going to take a couple of minutes to achieve an erection.